It was about 20 years ago when Natasha and her mother arrived in a very small, isolated rural hospital, both diagnosed with fever. They were both given short-course tuberculosis treatment, but as maybe you can see from the photograph, Natasha's mother responded well, but Natasha didn't. When I teach infectious diseases at university, I usually start at the beginning of the lecture by asking the students what they think our closest capital city is. This year was very interesting. It's usually Cairns, but this year it was Alice Springs, which is extremely disappointing. Something about our OP cut-off, I don't know. It's not, of course, it's Port Moresby. And in Port Moresby and in rural Papua New Guinea, we actually have the worst health outcomes in our region. The lowest life expectancy, the highest childhood mortality, and the lowest number of healthcare workers per capita of any country in the Pacific. Now you might say, well, that sort of doesn't matter with infections because we just go to the doctor and you get an antibiotic and you get better. But let me tell you about this disease, meliodosis. It mimics all other types of infectious diseases. So clinicians find it very difficult to identify it unless there is good laboratory support and clinical awareness. Our work over the past 20 years is to build that awareness, particularly in rural PNG. We've done so by training the local healthcare workers in recognising it, establishing diagnostic protocols, finding how the people actually acquire it. When Natasha turned up at the hospital, the fact that she didn't respond to TB treatment triggered our Maybe Meliodosis program. She was given the appropriate treatment, and after about 3 weeks, she actually got better. She's now about 23 years of age, and she has 3 children. Since then, we've identified meliodosis in this community. We've decreased the case fatality rates by about 100 to about 40%, still a fair way to go. And we've actually encouraged the medical fraternity in PNG to recognise it. And altogether, it's reducing the case fatality rates from childhood mortality in rural PNG. What we've also done, using fairly sophisticated sort of science in these areas, is to find out where the organism comes from in the environment and instigated public health awareness campaigns so people don't have to be treated, but indeed we can prevent the acquisition of the disease in the first place. Thank you.